Hello, my name is Mehta, and I'm the Vitreoretinal Surgery Fellowship Director at the Gavin Herbert Eye Institute at the University of California, Irvine. In our fellowship, we accept one American fellow per year for a 2-year fellowship, so there's 2 vitreoretinal fellows total. We have 5 retinal faculty covering everything from adult to pediatric retina, including inherited retinal disease. And we have 1 uveitis faculty member who's part of the fellowship as well, Dr. Sanjay Kadar. We have extensive training diversity in that all of us have trained at different programs. So we bring a different flavor of retinal surgery and the management of medical retina to our training for our fellows. In terms of diagnostic equipment, we have a full array of diagnostic equipment, including Heidelberg, Zeiss, and OptiView OCT systems, 2 different OCT angiography systems, as well as wide field angiography in fluorescein, as well as ICG angiography. We do electrophysiology, ERG, multifocal ERG, and microperimetry, as well as VEPs for patients who have neurologic vision loss. We do our own ultrasounds, and these are done by the retina fellows, so they learn how to do those very well. And all of this is integrated into the electronic medical record, which is EPIC, with the Zeiss Forum as the image management system. Will you be an injection monkey? No. In this fellowship, most of the attendings do their own injections all the time. Some of the attendings do some of lasers. The fellows do get their hands dirty in the private injection clinics and the private academic medical retina clinics as well. But in the academic clinic where the residents are involved, the residents do most of the injections as well. So the fellows will do some injections and some lasers, certainly the more complicated ones that the residents can't handle, but you're really not going to spend all your fellowship just doing injections the whole time. The fellows clinic schedule is as follows. As you can see, they follow with different attendings on different half days in different locations. They go to the Long Beach VA as well as the UC Irvine Medical Center and the Gavin Herbert Eye Institute in Irvine. From the surgical training schedule, you can see somebody's in the OR almost every day. This gives us a very diverse and intense surgical experience for the fellows. In terms of surgical training, we have all 3 major vitrectomy systems, the Alcon Constellation, the Bausch & Lomb Stellaris, and the Dork EVA, and the fellows become very competent at using all of them. In addition to vitrectomy systems, we also have different types of viewing systems, from the Oculus Biome to the Zeiss Resight and the AVI contact lens system. We do all gauges of surgery as well, and so the fellows feel very comfortable going into private practice or academia afterwards. In terms of surgical experience, the fellows graduate with, on average, 325 to 350 primary cases, between 700 to 1,000 cases, including assistant cases. There's a broad range of pathology from diabetics with tractional retinal detachments, membrane peels, secondary IOL techniques. We learn all those, and so we do a lot of those. I do typically 1 or 2 of those every week. So the fellows get very, very good at all the different types of techniques that are necessary to learn vitreoretinal surgery, including primary scleral buckles. We do primary buckles here as well, and pneumatic retinopexies are also experienced quite a bit here. This is what the EPIC EMR looks like. It looks just like any other medical record, and it includes a drawing program so you can draw what the patient's retina looks like as well. In terms of benefits and vacation, the salary and the health benefits are provided as an appointment as a part-time staff physician, meaning attending at the Long Beach VA hospital. As a result, the fellows typically make at least $65,000 a year, sometimes more, including extra hours they may spend at the VA because they bill per hour as an attending. Additionally, they get $10 per consult that they staff at the medical center that is accrued to their educational expense account. And additionally, they get 2 weeks of vacation per year. In terms of conferences, our fellows go to a lot of conferences. The first year goes to the sponsored vitrectomy courses. Dork, Alcon, Bausch & Lomb all have their own courses. There's the ARVO annual meeting. They're expected to present at ARVO in their first year. There's a Duke Advanced Vitreoretinal Surgery course, which is a very good course for first-year fellows to learn how to operate. And we have a local meeting called the American Retina Forum. The second year goes to even more meetings. In addition to the fellows-related meetings, the AVTT and the Fellows Forum, there's also ASRS and Academy that they tend to go to. These are important for the second year to go to because they need to get a job. And so this is a good place to go when people are looking for jobs. Out of pocket, they can also go to different courses, the Mass Eye Year course or the Vit-Buckle Society course in their second year as well. In terms of call schedule, because there's 2 Retina fellows, they alternate call. So usually they do about a week on, week off. But the first year doesn't start their call until August, until they really get their feet wet and understand how the system works. Otherwise, it's just too much too soon. So we like to ease the first year into the schedule because it gets pretty busy here. The residents cover the ER calls and the county patient phone calls, but the Retina fellows do cover the attending's private patient phone calls. On average, 1 to 2 detachments present after hours per week on our service. In terms of trauma call, all 6 fellows across the entire department cover the trauma call. This is ruptured globes and accepting transfers from other hospitals. On average, there's a ruptured globe about once every 2 weeks. In terms of research and clinical trials, the fellows become co-investigators, usually injecting physicians for clinical trials at UCI. There's also bench work if you're interested in bench research as well with our basic science faculty. We have a very nice vitreoretinal wet lab with experimentation. You guys can run trials there, you can run whatever you want, and you can practice retinal surgery. We have a nice Zeiss microscope with the ReSight hooked up, and industry has been very kind to loan us vitrectomy machines and packs so we can practice vitrectomy. We have a model eye that's designed to practice membrane peeling as well as vitrectomy in our system here. In addition, if you want to use the TrueVision heads-up 3D viewing system, you can use that as well. Where we work. So we work in 3 different major locations: the Long Beach VA, the UC Irvine Medical Center in Orange, which is an exit away from Disneyland, and the Gavin Herbert Eye Institute. In terms of Disneyland being so close, we've had fellows over the years that have season passes to Disneyland and just go to Disneyland for a few hours after clinic every day. It depends on how much you like Mickey Mouse. But Orange County is a great place to live. It's very close to the beach. There's a lot of stuff to do. If you want to go to LA or San Diego, it's pretty close. It's a short drive to either place. LAX is a 45-minute drive from Irvine. And so there's an airport in Santa Ana as well, about 5 minutes from the Eye Institute. So if you need to get away, you can get away as well. The commute is not bad because most of the time, if we're in Irvine or UCI Medical Center, it's really not a very, very long commute, 15, 20 minutes, depending on traffic. Irvine's a very bike-friendly town. There are bike lanes everywhere. So if you like riding your bike, it's a nice town to live in. Orange County is gorgeous. There's lots of hiking and pretty trails to go on. And if you like the beaches, we've had fellows over the years who are avid surfers, and they would go surfing in the morning before clinic. Just as long as you don't damage your hands, we'll be okay. Mountain biking, there's mountain biking trails all over Orange County as well. Our former fellows, you can see, have gone across the country, but a lot of them like to stay in California because California is such a wonderful place to be. A lot of them take jobs at Kaiser because they're good jobs that are available in Southern California. Some of them go to Northern California. But these are a list of our former fellows. If you have any questions, feel free to ask our fellows. Sid and Peter are our current fellows. And then Sean, Angeline, and Tamara have graciously given their email addresses for people to email them if they have any other questions, or any of the faculty member as well. Please ask any questions you want, and we're looking forward to hearing from you. Take care.